Yes.
Is that better?
Yeah, it's okay.
Thank you. Yeah, so I'm a forensic psychiatrist, and we deal with people with mental health conditions, severe mental health conditions, and they have committed significant offenses, significant crimes. We're talking about murder, sexual offenses, fire setting, criminal damage, things like that. And a lot of our work involves clinical work with patients in hospital and outpatients, and also patients in prison. But again, a lot of it is academic research. So in Oxford University, we developed a tool for risk assessment for psychiatric patients. We call it OX Risk. You can Google it, OX and then risk, and that will give you. It's a quick tool that will enable you as a clinician to predict the risk of violence, predict the risk of suicide, predict the risk of future offending or reoffending. And of course, every step in that pathway, or every uh, domain was governed by a lot of academic governance, writing, ethical, writing a lot of ethical issues, or being aware of the ethical issues around research, not just jumping and doing research haphazardly and not consenting patients or asking patients to take part in their research or knowing more about them. I remember when I did medical school in Iraq, we had like a graduation project in the last year of year 6, like the final year. And my topic was in obstetrics and gynecology, and it was about complications of teenage pregnancy. I think it was a very good. I liked the project. I mean, it won the first prize in the medical school, I think, for the obs and gynae specialty at the time. But the thing, and when I reflect about it, I don't think we asked, I don't know how many, 20, 25 patients, ladies who are under the age of 19 or 20, like teenagers, about their participation in the research. We didn't have solid research ethical considerations or criteria. We asked them, okay, do you want to take part in this research? You would say yes, or you say, no, I'm not interested. But things like that are very important. So we have to make sure that our patients are involved and we can talk more about it. Yes, linked with the number of organizations, and I don't have a conflict of interest. I chair the Iraqi Mental Health Forum, which is the Iraqi gathering of Iraqi psychiatrists working in the UK.
العفو دكتور حسن, ممكن to show the slide in the presentation mode.
You can see the slides now?
نعم دكتور أشيدك.
Okay.
Moving?
Okay. Yes.
Okay, thank you. Sorry about the confusion. I wasn't moving any slides anyway. So I was just talking about the experience and research in Iraq and everything. So yes, I think it should be moving now, I hope. Okay?
نعم دكتور. Okay.
Oh, it's okay.
Thanks very much. Again, this is one of my best achievements in life, alhamdulillah. It's being nominated for the Wall of Honor at the Royal Society of Medicine for people who contribute to medical education and training around the world. I think I'm the second Iraqi doctor. First one was Dr. Qais Kubba, who was our teacher in medical school, the obs and gynae doctor many years ago. And interestingly, my name appears just like few names below his name. So thanks to all my educators and my trainers and my colleagues and my students, of course, who supported me to go through this nomination, and of course, everyone over the years. So what do you need to do to be a good researcher? Like, you can speak from your position. What you need to be, what qualities you need to have, or what personal attributes you need to have to be a good researcher? Anyone want to say anything? So you need to be inquisitive. You want to know more about evidence, why we use evidence-based, what is evidence-based. I know when, for example, when we trained, we know that we treat chest infection with antibiotics. You treat psychosis with schizophrenia, depression with antidepressants. You need to treat hernia with a surgical intervention. But all of these modalities of treatment are evidence-based or should be evidence-based. We have good evidence that antibiotics work in bacterial chest infection. We have good evidence that antibiotics don't work in viral infection, and it's you have to treat, just leave it for the virus to disappear and the cycle of the infection to resolve and spontaneously remit. So it's all about self-evidence or evidence-based medicine and what we do, and all our practices should be evidence-based. So what Albert Einstein said many years ago, so he said, if we knew what it was we were doing, it would not be called research, would it? So if we think we know what we are doing in whatever topic, it will not be called research. So we do research and we want to know more about the field we are studying in medicine or in any other topic, because we want to know more about it. We want to know to be better clinicians, better academics, better educators, and of course trying to find new ways of doing what we do, or reflecting about previous experiences and learning how to do things differently in the future. So research and ethics. So it's balancing knowledge and responsibility. As you said, it's a big responsibility dealing with human lives, treating patients, treating their illnesses, alleviating their suffering. So we know we have a lot of knowledge, and we know that there is a lot of people suffering around us and globally. And so we have, the trick is to how to apply this knowledge and how to apply these skills to manage these patients, and balancing what we know and against what we do, and against the our responsibility to the human society. So what's research ethics? So it's a framework of principles ensuring the integrity, respect, and fairness in research. So it aims to protect participants, maintains trust, and upholds the credibility of scientific inquiry. So what we need to do, I mean, what's the framework is, we have to always use, like in our practice, work with integrity, with honesty, being trustworthy, show respect to the profession we are working in, show respect to the patients, show respect to the participants of people, participants of our research project, and of course treating them with fairness and treating them with honesty and openness. And our eventual aim is to protect the participant, maintaining their trust in the field we are studying. It's in medicine or the research or anything we're doing, and uphold or support the credibility of the scientific inquiry. So upholding the credibility means like supporting the credibility or sustaining the credibility of the scientific inquiry. What we are doing is actually for the benefit of the human race and for the human society, and it's not for our own personal interests, or you want to publish your name in a paper and that's it. So you have bigger roles and bigger aims, which will help you achieve the evidence-based practice with good research, with good integral research projects. So what are the key ethical principles? Again, this is in medicine, and I'm sure you will know about this from your medical study. Respecting autonomy, so it's right for the patient to make their own decisions and give informed consent about the treatment they are choosing. There is a center in Oxford University about values-based healthcare. So it's about your values. There is a little test or a quiz. We ask the trainees or the participants to do something like, do you want this intervention? For example, if you have a specific illness and you have an intervention which will give you 10 years of survival with little bit of pain or discomfort or disability, and the other intervention will give you maybe 5 years of survival, but with no pain or disability or discomfort. So which one would you choose? Some people might want to go with the 5 years of with no pain and discomfort, having normal lives. Some people might choose the 10 years. They will say, actually, I need 10 more years to achieve what I want, or I could cope with a little bit of pain or discomfort. So it's all about values. So my value may be differing from your values or from the values of the audience. I might go for the 5-year option. Somebody else might go for the 10-year option. So it's all about informed consent. And it's about the values. So if your values are not similar to the values of the person you're interviewing or you're taking part in research, that's fine. That's life, because people will have different opinions, will have different values, will have different practices. The other point, or the other key ethical principle, is beneficence, which is causing no harm or minimizing harm to participants. So maximize the benefit and minimize harm to participants. So sometimes we think about interventions which might empower patients or certain group of the population to take some. So think about maybe somebody who has an ischemic heart disease, and you give them a medication for a blood thinner product, and that will help reduce the risk of future clots or future thrombotic events. And you don't want to disadvantage the other group, which will receive a placebo, for example, because that might increase the risk of thrombotic events. So cause no harm or try to minimize the harm to the participants. And justice, of course, fairness in the distribution of risk and benefits, and equitable selection of participants. So try to be fair in when you select your participants, and fair distribution of the risk and benefits to the group of participants you're doing. And of course, integrity is definitely one thing which we always do in being honest, transparent, and accountable in research conduct, and of course in our clinical lives when you deal with patients. So again, another quote about ethics. So ethics is not an abstract intellectual discipline. It's about the conflicts that arise in trying to meet the real human needs and values. So it's all about human needs and values. My values might be different from yours, as we said, and we have to respect and treat everyone with equity and equality and respect. And we're talking about research participants here because we are talking about a vulnerable group of the population who are patients. So what are the ethical dilemmas in research? Informed consent, as I said. So every research project, you will know from your experience, or if you haven't done research and you will do that in the future, every project you will have a consent form. So 1 page or 2-page summary of explanation of the study. So why you're doing this study, what are the benefits, what are the side effects, what are the disadvantages. Some institutions will give a little bit of money, for example, for travel money or vouchers to buy things from the shops. So yeah, explaining everything in the consent form. And that's balancing the need for informed consent with issues such as vulnerability and the potential for coercion. So making sure that they are not obliged to come to the research project. So, for example, you don't give them $200 to come to the project, like by force. They have to do voluntarily choosing to be part of your project. You might give them a little bit of money, as I said, to compensate for the travel, if they like £10, £20, something like that, or maybe give them some like refreshments or something, which is not a big thing. Of course, the other thing, a very important thing, is confidentiality and protecting the participant confidentiality and data, and ensuring data integrity and transparency. It's a big thing here in Europe and many countries that many people don't want to take part in research because they say, I don't want my data to be known to other places or the public. I don't want my date of birth or my medical conditions to be known to the public. So that could be another factor, another ethical issue that we have to face. balancing the risk. I mean, how do we tell them, or how do we manage the confidentiality? We tell them that all the data will be stored in an electronic drive, it will be in a safe place. And once we do the research, we conclude the research, all the data will be discarded, all the data will be removed, something like that. So your data will be safe. And we hear sometimes in the news every now and then a big breach of data or a leak of data, not necessarily in medicine, but other disciplines. And that could be a big thing, especially, for example, the Home Office, the Ministry of Interior, they had some leaks some years ago, like WikiLeaks and things like that. And that could really affect people confidentiality and data protection. Balancing the risk and benefits, so assessing and managing the risk to participants against the potential benefits of research. And of course, fairness in participant selection. We said ensuring equitable representation whilst also meeting research requirements. So I don't go and do a research and I choose the younger population, like people from 20 to 30, because they are much easily like trainees or students or something like that. Yeah, because they will be they will do what I tell them to do, and I don't choose the wiser or the older or the more senior population, because they'll be quite difficult to talk with. Or so fairness in participant selection. If you want to do a good sample or a good appropriate sample to study, you have to ensure that you have representation from all age groups or from all ethnic backgrounds or whatever depending on what you're doing, of course. Any questions or any queries so far? If there is nothing, we can continue.
الدكتورة زهراء رفعتها. You can open the mic.
السلام عليكم. بس عندي سؤال بخصوص آخر نقطة.
نعم.
fairness and participant selection، يعني هو ما يعتمد أيضا على ال inclusion وال exclusion criteria؟ إذا بحال عندنا inclusion criteria إنه بس تكون للold age يعني.
اي طبعا. لا هو اكيد يعتمد على what we are studying. احنا مثلا we want to do بس all people. Of course we choose only all people. بس مثلا ما اقول، خلينا نقول نعطي غير example. مثلا in a country like the UK نقول مثلا او بالعراق حتى، مثلا ما اروح على بس جيراننا الكبار اعرفهم فراح يمشون وياي ويقولوا لي اوكي نشارك بالبحث. لازم اسوي البحث على اكثر من جهه، يعني كل الكبار خلينا نقول ببغداد او بمحافظه معينه، مو بس جيراني او مو بس قرايبي. If that makes sense. So it would be fair. Participant selection should be fair. Of course طبعا هي depends on the selection, inclusion and exclusion criteria. If that answers your question.
تمام، شكرا.
مثلا نقول احنا بانجلترا اكو هنود باكستانيين وافارقه وبيض. والله انا اعرف، او العرب، انا اعرف العرب فاروح بس على العرب. They will be easily taking part in research مثلا, or exclude the white people or Indian people. Now this is wrong, because your sample is not selected, unless of course you're studying only Arab people living in the UK and studying something about them. But if you want a fair representation or fair cultural or a robust cultural base, لازم تشمل الكل. Dual loyalties, so navigating conflicts of interest between interests of the researcher, institution, and participant. نسمع, we يعني hear a lot about شركة الأدوية الفلانية, they did this and they promoted this medication because it was financial interest. For example, they say, okay, like, yeah, I mean, technically they promote this medication because they think it's very good, not because it's very good, but because it's produced or manufactured by that company. Or we have pharmaceutical representatives talking about X, Y, and Z medication, not because it's a good medication, but because they manufacture that. Now, as researchers, as clinicians, we should always be aware of this conflict of interest, that if you are doing something right, if you're doing a presentation or promoting a drug, it should be because it has a good evidence base. It stops this disease or controls this illness or stops the symptoms, something like that. And a very important topic is deception. We should always avoid ethical concerns regarding the use of deception in research and its impact on participant trust. we again hear a lot about projects when people just made up data, or took data from other sources, or took data from other research studies which were published before, or maybe unpublished data which they managed to get. So, of course, any deception or ghish or talaab is not acceptable and is not part of the ethical research. And yeah, if you, for example, if you can't find the sample size you want to, then just say I couldn't find it. Like I remember when we did the teenage pregnancy research years ago, I couldn't find more than 20 or 25 ladies in the obstetric department in Baghdad. It's very difficult to find less teenagers at the time, under 19 or under 21, I think. So it was difficult. It was like, so we managed to get something like 17 or 18. And you have to say that, yes, it was difficult to get the sample, or that's what we found within 2 or 3 months of preparing for the research. Just be honest and open about your experience with the research. Data handling and ownership is, of course, very important. So balancing the need for data sharing, transparency, and we have to be mindful always protecting the privacy and rights of participants. So not kind of exposing the data or breaching the data, as we said, and knowing more about patients' confidentiality, which is a big thing and a big ethical issue. And resolving these ethical dilemmas, so reflecting about all of this, what we said earlier, requires careful consideration, adherence to ethical guidelines, consultation with the ethics committee and peers. So in every university or every research department, there is an ethics committee. So if you have an ethical issue or a query about ethics, we always go to that ethical department and say this, and that. So these are the ethical issues I'm facing, and how do we solve them? With every research project, there is a big section about ethical considerations, or big, at least 5-6 pages of how your research is ethically and clinically viable and safe, protecting patient data, protecting vulnerable patients. So historical ethical violations, so that from the history, for example, the Tuskegee syphilis study in the many years ago, it went for a number of years. So there was a denial of treatment to African American men. Of course, this is very racially motivated, that people who had syphilis and they were African Americans, they were denied the right to have syphilis treatment. And it was good treatment, and people that, of course, this doesn't happen in this anymore. The Nazi Germany in the years ago, the inhumane treatment of prisoners for unethical experimentation. So they used the prisoners for using experiments on them, clinical experiments, or trying drugs on them, or medications, or things which were not approved for human use at the time. So what we learned from these experiences is the necessity for ethical review boards, ERB we call it, for international codes. So, for example, the Nuremberg Code and the Declaration of Helsinki to protect human rights. And of course, we have the Human Rights Act, the United Nations, that we have the articles of it, 2, 3, 5, and 8. These are the main ones that the person should choose to live with, where to live, and to have an independent life. So these are the basic human rights that every organization should follow. And as a clinician, we should always follow them and empower the patient or the person we are dealing with to live normal lives. So what we call it IRBs, or institution review boards, or ERBs. So their role is to review, monitor, and approve research involving human beings. So any research project involving a human, like any human intervention, have to be reviewed by that IRB. The purpose of it, ensure compliance with ethical guidelines. We're not exposing people to harmful products or harmful toxins or harmful medications or chemicals. because as we said initially, we have to balance the knowledge against the responsibility. It's a big thing. We know that maybe I think it's a good medication, or I think this is a good intervention, but you might disagree with me, or the other person might disagree. Unless we try it and we make sure that they are safe interventions, we cannot try them on the wider scale, on the wider population. So ethical or ethics in different research contexts. So we said patient safety and informed consent, cultural sensitivity and voluntary participation, so in social sciences. So as we said, voluntary participation is very important. I don't go and coerce my neighbors or coerce my relatives to come to my research group or to come to take part in my research, and exclude the other parties or exclude the other members of the population. That would be a very skewed result, a very result which is not very good. And with the current advances in internet and AI, data science, there is a lot of emphasis about privacy and confidentiality, bias and transparency, and a lot of not debate, but ethical issues, really dilemmas about the use of AI in data sciences. I think there are lots of AI platforms, but some of them are very advanced, and some of them they go into details of patient data, and some of them are not very protected or not very safe. Others are probably safer to use. So it's a big evolving topic. We learn more about it every day because this is a new topic and it's advancing every minute. So this is, again, because we are dealing with patients, and patients are vulnerable people. And who are the vulnerable people in our society? Children, so children under the age of 18, 16. I mean, children, depends on the age limit of childhood. So anyone who is under the age of 18, for example, in most countries worldwide, special care must be taken to ensure that they have informed consent, minimize harms, and involve appropriate parental or guardian consent. So many years ago, I think they were trying to try some new contraceptive pills for young women. And I think there was a lot of debate about who should take part and how old the person, should they be more than 18? And some people said, actually, no, 16 can be, they have good mental capacity, they can take part in research, or they can take part, they understand the side effects, the pros and cons of taking contraceptive pills. So a lot of debate. So are they children, are they not? But again, in general, you have to make sure that these children are protected, especially if we're talking about children like 10 or 12 or even younger, and we must take in enhanced observations and enhanced measures to protect their rights when they take part in research. On the other spectrum, we have the elderly population, people who could have cognitive ability, getting dementia, getting medical and psychological problems. They might be susceptible to coercion, like under the influence, or they might be susceptible to influence from other people. So, okay, I'll go to the elderly people in my area or my hospital. I'll take part in my research and I'll give you, I don't know, good medicine, or I'll give you more, whatever, I don't know, some advantages. This is wrong. So we have to make sure that they are not coerced, they are not obliged to come to that research project. They have to have the informed consent. You don't go and maybe make someone participate in research and they have severe dementia or they have severe cognitive decline. They can't make rational decisions, or they can't maybe communicate, or they can't talk, they can't weigh up the advantages and disadvantages of taking part in that research. This is not ethical at all. Also, the third group of population who are vulnerable, people with intellectual disability and cognitive disability, ensuring that they understand, provide accommodations, obtaining consent from legally authorized representatives. If they have a little bit of intellectual disability or autism or something like that, you could support them. You don't give them the consent form, the long paper form. You could then give them pictures like, okay, this is what we are doing, and this is what you will do. I don't know, if you take a blood sample from them, or if you do a chest examination or an eye test, something like that. So explain that in pictures. And if they are happy to take part, and if they have the consent or the mental ability to consent for that and agree to it, you can proceed. Otherwise, you cannot proceed. Is that clear? Yeah. Pregnant women, of course. Balancing potential benefits to the mom with risk to the mother and the fetus, including ethical considerations and around fetal autonomy and consent. Because you don't know whether some interventions or medications might be harmful to the baby. And we've heard a lot, and you know about the disasters which happened with the introduction of thalidomide and other medications in the past, where they were born with deformities. And now we have, for example, the recent studies about the use of valproate, the mood stabilizer or anti-epileptic, in pregnant women that can cause neural tube defect. So even in men now, when we prescribe valproate, you have to be extra careful because it could induce teratogenic and neural tube defects in the children of the person taking valproate and mood stabilizers. Prisoners, we do a lot of research, for example, when we do forensic psychiatry research with the prisoners. Or maybe some countries might say, oh, these are prisoners, they have no rights, they have no benefits, so we can use them for, I don't know. It's like the Nazi example we mentioned earlier, addressing power differential. They are kind of disempowered. They are in prison, they don't have any liberty. We can use them. Again, this is not ethical. And socioeconomically disadvantaged groups. I don't know, talking about homeless people or people who have lower socioeconomic background. So if you give them $50 or whatever, you'll kind of buy their interest. تشتريهم حتى يجون للبحث, which is wrong. It's not. You shouldn't use that money, financial incentive, to get people into your studies. And you should provide addressing power differentials and ensuring fair compensation, participation بس للمشاركة, بس مو تعطيهم مبالغ ضخمة حتى يشاركون بالبحث. And we always need extra safeguards such as enhanced informed consent process, independent advocate. So advocate is someone who will sit with the patient and tell them more about the research, somebody who is impartial, طرف ثالث محايد. They don't have any interest in the research project, and they will help the participant in making sure that they are taking part voluntarily without coercion or abuse of their right. So we talked about, the big data, emerging ethical issues, the collection, use of, and protection of massive amounts of data, especially regarding privacy, consent, and ownership. منو سوى البحث؟ هذا من جبنا البحث؟ إلى آخره. Artificial intelligence in bias, fairness, transparency, and accountability, and AI algorithms and applications in research is a big thing. Genomic research and genetic privacy is also a big emerging topic, and potential implications for groups and individuals, of course. And social media and digital platforms, including consent. Some people do research on social media, maybe. So if you have your pictures on different social media platforms, do you have consent, or have you consented to these people taking part? So the potential use of unintended harm or exploitation of these widely accessible data. And reproducibility and research integrity. So we said, so we shouldn't use other people's projects or data which were not published, or studies which are not published, to use it for our own purposes and promoting our own research projects. Sometimes other ethical issues, global research collaboration. So if we're doing, I don't know, an randomized control trial, RCT, on between different countries, again, how to be mindful of the participants' disparities in resources, power dynamics, cultural differences in research practices and ethical norms. For example, if I do a research here in the UK or you do it in Iraq, I don't know what's happening in Iraq for the participants, how people are getting into the project, or in India or in China. We don't know if they are, how people are getting involved in this research. Are researchers involving them by power, by financial gain? We don't know. So you need to be more mindful of these dynamics. And neuroethics, so advances in neuroscience, such as brain-computer interfaces, cognitive enhancement technology, and of course, neuroimaging techniques. These are the new, what we call it, neuroethics, so new emerging ethical issues. So what's next? What we can do to maintain or to sustain good development of research and good research skills. If you want to do any research topic or a research project, you need to be mindful of these things we mentioned: maximize benefit, minimize the harm, and be mindful of these ethical dilemmas. Don't involve patients by coercion, and give them the right to choose and the right to have informed consent. So developing personalized action plans. So for every research project, identify the ethical issues in your project, review ethical guidelines, familiarize yourself with the relevant ethical guidelines in your department, regulations, institutional policies, and governing research ethics in your field or area. Dr. Shakir kindly sent a document yesterday, which is من وزارة الصحة العراقية, which is how to technically what we talked about in يعني معايير البحوث الصحيحة. I'm sure he could share it with you, or I could share it. Establish an ethics committee. If applicable, establish IRB, Institutional Review Board, or an ethics committee which looks at the ethical considerations in the research project in the university, in the Department of Health, whatever you're working. An informed consent process. Make sure that you develop a plan, an informed consent process for your participants, and tailor these forms to literacy level, cultural background of patients or population. So again, language barrier, if there are like Arabic, English, Indian, Chinese language, make sure that they cover all the backgrounds. People with intellectual disability use pictures rather than convoluted, long, detailed forms. So being aware of these things. And identify potential risks to the participants, develop strategies to mitigate these risks, ensuring participant safety and well-being throughout the research project. So for example, in Oxford University, they do a lot of research in different topics in medicine and other fields and disciplines. And when we do on-call duties, there is what we call it a research on-call person. He's a doctor or a specialist nurse or a pharmacist. And if the participants need any queries at night or have any issues with the medicine they are taking, like only research rota, just for the research doctors or nurses who are doing research, so patients could contact them if they need to. So mitigate the risk of side effects, maintaining data security and confidentiality, and of course, addressing the vulnerable population. People with disabilities, we said pregnant women, people in prison, elderly, and children. And ethical data handling, get rid of the data once you finish your research project. Regular ethical reviews, so conduct ethical reviews throughout the research process, and make sure if they address any emerging issues, if there is a change in circumstances, and provide ethical training and education to research team members, ensuring everyone involved understand their ethical responsibility and obligations. I think that will come to the end of the presentation, and Thank you very much for taking part and for listening. And if you have any questions. Thank you. There is a question from Dr. Muhammad or Muhaymin Ali. There was a surgical procedure that was done by Dr. Walter Freeman. He performed lobotomy to treat schizophrenia patients. Why it was considered to be unethical and how it can be ethically acceptable. And if anyone wants to conduct a research about people who cannot give consent or how we can do it. Yeah. So I think people tried lobotomy many years ago. Nobody will do it now, but it was, I think there was a degree of coercion. So people were يعني غصبوا إنه يجون على البحث, or they, as you said, some people didn't give consent. So he used that vulnerability, that weakness to do his research or his procedure, which was definitely wrong. Patients with schizophrenia who يعني أنت تقول they can't give consent, it's not right, because many people they can give consent. We're talking about people who are maybe severely disabled by the illness. They can't give consent, or they might refuse to give consent. But otherwise, we treat everyone with dignity and with respect. Even if they have severe mental health condition or severe physical condition, you should always get the right consent from them. Don't assume they don't consent. Even if they are, for example, their consent or refusal to consent is based on delusions or psychotic symptoms or some sort of thought, they might not want to share this, but don't assume that they don't have consent. So always go with they are consenting. I hope that answers your question. Thank you. Any other queries or questions? I could share the slides with, I think I shared it with Dr. Shaker, so he could share it with you as well.
Okay, just a few notes. First, I shared with all attendees the Code of Ethics in Research adopted by Ministry of Health.
Thank you.
It is based actually on the guidelines from the international institutions, Helsinki, Belmont, and others, and WHO. But it has been manipulated to agree with the Iraqi situation. Also, I would like to let everyone know that in Iraqi Ministry of Health, we have ethical committees, one at each health directorate, and everyone who is in his way to do a research should apply the protocol to gain acceptance. We are not only verifying the protocols just for the presence or absence of ethical consideration, but also to improve the quality of doing research according to the standards. I have a question waiting for others to ask theirs. You know the effect of AI in every part of our life, including research. AI and its role in writing the protocol, in analyzing the data, and even to write major parts of the article later on. What is the ethical consideration now? I know this is probably evolving, but what is the recommendation in the UK so far?
Thank you. A very good question. I mean, it's something which is evolving. Everyone is using it, and I think it makes life much easier. But again, for certain things, you can't. In the UK, we say we shouldn't use it for patients' data. So, for example, I can't use it with patient data. So I can't put it, I don't know, my patient data, names, date of birth in that AI platform, because that's a big confidentiality breach. And you shouldn't use it to write research projects. You can, for example, ask the AI, okay, I want to do a research about, I don't know, global warming, and give me some ideas about global warming. Or I want to do research about reducing the risk of, I don't know, DVT in pregnant women or in elderly people. So give me some questions or some ideas, something like simple. Don't go into writing, or sometimes you give him or give the platform some ideas yourself. So I'm thinking along these lines. So I'm thinking 1, 2, 3, 4. هذه النقاط اللي ببالي. So tell me how we can do something like that. So it will give you brainstorming, something like that. You shouldn't use it extensively to write a research project, because بعدين راح تنكشف لأن there are lots of platforms which can detect this is AI. Even like school and universities, they do it a lot. So if a student is writing something from AI, they will know the school يعني القسم أو الأستاذ راح يعرف, because there are softwares which will detect this is AI, this is not AI. So if you want to draft like a research question or a research project, it's fine, but as long as it's not the whole work, or it's not like a big percentage of the written material.
Thank you.
Thanks.
Questions from Dr. Ghasaq. In some cases, such as patients with HIV or alcohol-related liver disease, it can be challenging to obtain accurate or complete information due to stigma, fear, or denial. What are the best strategies to encourage patients' collaboration and build trust in these situations?
Yeah, really very, very good question, Ghasaq. Thank you. Yeah, difficult, like a difficult one. But again, we think of this population or group of people as vulnerable people, that HIV or alcohol-related liver disease. Challenge, they're not going to talk about how much alcohol they drink or what's their sexual orientation, or they have HIV because of stigma, because of fear, exactly. So how to encourage, I mean, in a gentle, sensitive way, if you put that in your consent form, to say, I will protect your data, nobody will share this data, nobody will know more about this. It's anonymized, so ما نكتب اسم المريض وتاريخ ميلاده وعنوانه everything, because we will know everything about them. بس مثلا تكتب initials and data or something else, or رقم آخر رقمين من تليفونه إلى آخره, or something else, or just give them numbers. So lots of research projects do numbers. كل مريض تعطيه رقم معين, يعني مثل رقم التليفون, or nobody will know what this number is. So it's just unknown data, or بس أبو الريسيرش راح يعرف which number is which patient. So making sure that your data is confidential, encourage them to participate, يعني هو لحمايتهم أو لحماية بياناتهم. تقولي له ما حد راح يعرف. So this is a way of dealing with it, of encouraging them to do it. Thank you.
Dr. Osama Athir, should informed consent be obtained from all participants in the research, even if there is no real interference? Should these consents be documented and sent to a specific party or attached to the research?
Yeah, good one. Thanks, Osama. So yes, all consent forms should be taken from all participants, even if there is شنو تقصد no interference, يعني no interference, no coercion, or
The drugs probably, or surgical intervention.
Or intervention. هي طبعا anything which is, even if it's like you're asking a patient a questionnaire, يعني تشوف مريض وتسأله مثلا I don't know about their symptoms of chest pain or symptoms of respiratory disease or mental health. So yeah, you should take informed consent and keep it in your research department. Keep it يعني ما تكتب اسم المريض, تكتب الانيشيالز, أول حرفين من اسمه مثلا, أو أول 3 حروف, أو رقم معين, and attached to the تخططيها لجماعة الإثكس أو الإثكس body وتخليها بالريسيرش عندك, بس ما تنشرها طبعا, بس make sure that everyone has taken part voluntarily, or they are happy with it, they know the side effects, they know the advantages, disadvantages of taking part in the research. Thank you.
If you allow me, Dr. Hasanen,
Yes.
in this part, a consent form always required, but the issue is whether written or oral.
Or oral, yeah.
I think in our code of ethics in Ministry of Health, we separate what things require written وكل الانtervention طبعا. In addition to the vulnerables ويا non-intervention. While the oral consent, for example, if your study is questionnaire-based, CAP study, for example, at any part of the knowledge, you can consider filling out forms and return it back to the researcher is enough to be acceptance. طبعا in this part of issue, but you have the right, the duty to inform all participants about the aim of your study, about the procedure going to be, and the benefit from the doing such research, and assure them that everything is going to be confidential.
بالضبط صحيح. Thank you دكتور شاكر. نقطة يعني بالضبط هي in many areas this is verbal consent is required. Sometimes written consent is required. It depends on the intervention, depends on the type of the project. Sometimes you do an audit or a little quality improvement work. It doesn't need a big intervention. So verbal consent, or maybe you send an email to the participant, they will reply back to say, yes, you have my consent. Something like that, like you're getting a consent for patients. Verbal consent would work sometimes. But if there is an intervention, an active intervention, it should go through the ethics committee, and it should go through lots of ethical clearances. صحيح.
Dr. Zahra Ammar, then can I use AI to edit the article I wrote in terms of making it clearer to read, or that also prohibited and can be detected?
No, صحيح. Good question. احنا مثلا انت تكتبين بالفرنسي، اوكي، واحنا لغتنا الاولى not فرنسي. ف if you're doing something like your or English, it's not your first language. So you can use it maybe to correct grammatical mistakes or correct layout. This is fine, I think, as long as it's not interfering with the body of the project. انت سويتي الشغل وسويتي البروجكت، جبتي الداتا من الناس واشتغلتي 99% من الشغل، فit's fine. بس الماينر هذه يعني خلينا نقول الديتيلز والماينيوت ديتيلز, it's fine to use a program which will help you with that, as long as it doesn't affect the body of your research. الايدياز انت جبتيها من عندك او من الديبارتمنت، ف tidying up ترتيب الصفحه هذه shouldn't be a major problem. And that's in my opinion, I think that should be fine. As long as you're not inventing the idea. مثلا ثاني عندي فكرة ما أعرف, I want to do something about improving education or mental health or whatever health in this country. I have the idea وعندي the questions, بس tidying up ترتيب maybe الكلمات والجمل, it's fine to do it in a nice way, يعني quick way, as long as it doesn't interfere with the topic, with the ethical issues.
Any other questions?
Thank you. It's really interactive session.
Written أعتقد أبو, was the action of Barry Marshall by ingesting bacteria to prove it links to PUD and gastritis considered ethical? The discovery of H. pylori is okay. The discovery of H. pylori as living bacteria in the stomach, knowing that this physicians had patients in the hospital under his care, discussing the concept of prioritizing future patients on present ones, because he could have been diseased and wouldn't be able to take care of his patients.
Yeah. I mean, again, without knowing the ins and outs and the details of every setting, and we can't say this is ethical or unethical, بس يعني الطب بصورة عامة, we have in our history lots of projects which were not ethical, lots of projects. For example, Nazi America or Almania Nazi, they used children with intellectual disability, with autism, to research on them or to give them medicines, or حتى, for example, Asperger syndrome. We stopped the use Asperger, ما نستعمل اسم Asperger, because he was Nazi child psychiatrist who was using children to يسوي تجارب عليهم. Nobody is using this term anymore. طبعا Tariq was full of unethical practices, but again lots of good ethical practices. So without knowing the details of what happened, we can't really give an exact answer. بس مثلا اكو project صارت how sildenafil Viagra was discovered. It was something, or how valproate was seen as a good mood stabilizer for they treated I think it was a neurology ward where everyone was treated valproate for epilepsy, and then they saw that the mood had improved. كل المزاج متحسن الناس اللي على valproate او اغلبهم. So they discovered that valproate could be used for depression or for bipolar depression. So the original intention was to treat epilepsy, but now we have discovered that this medication or this intervention could have another beneficial effect. So you could use that. So it depends on the intention, the question behind the research project, and of course the مثل ما قلنا احنا لازم always تتذكر البرنسبل cause no harm, maximize benefit, reduce the harm. فإذا الشيء اللي تسويه بيه شوية benefit it's fine, بس إذا بيه harm أكثر من الbenefit you should stop it, or you should make the patient aware or the participant aware that you shouldn't continue with that project, because they might say I don't want you to continue. بعدين مثل ما قلنا تعتمد على values. Be aware of the patient's values, what they want to do. Do they want to continue with the harmful product? Do they not want to? It depends from one topic to the other. So, yeah.
Something to add, الحقيقة, unethical issues early, for example, in the last century, has achieved many good things. For example, invention of antibiotic and its introduction into clinical practice in mid-40s, and also the use of steroid in treating rheumatoid arthritis. The first has ended with catastrophe. But we should apply the things we consider it ethical in the term of our years, not the previous one.
بالضبط. حتى أحيانا يعني I مثلا some intervention could be seen as unethical, or my values مثلا أنا ما أريد إذا صار عندي حادث I don't want my hand to be amputated. I see it as maybe very bad catastrophe. So I have advanced directive, or maybe in the UK, for example, you have what عندك قرار مثلا I don't want my leg to be amputated in an accident, or I don't want this, or I don't want blood donation, something like that. So I always respect the patient values, or always respect if they have advanced decisions about their treatment, about their future treatment, and not مثلا انت تقول رأيك I think you should do this. Yes, fine, I respect your decision, but as a patient you should always take my values and take my consideration in this topic, because this is the most important thing we're dealing with.
نوع raised hand.
السلام عليكم. هشترك دكتور على السيشن، بس عندي سؤال. شنو رأيك يعني من ال ethical boards deny, let's say, high risk research that can be harmful to the patient, بس the risk reward benefit may be good or mediocre. يعني إذا حصلنا informed consent هل ممكن البورد يرفضها؟ يعني يأثر على تقدم knowledge؟
If you have a good case for making a good case why your ethic or why your research is ethically safe, ethically plausible, you should submit it. Even if it's rejected, the board will tell you why they rejected it. So because of 1, 2, 3. So if you address 1, 2, 3 points, write back to the board and say we're minimizing harm. I would say يعني من تكتب مرة ثانية we appeal the decision, always try to mention these principles. I'm doing يعني اكتب paragraph or something to convince the board why it's maximizing benefit and how it's minimizing harm, and show them like, yes, it will be like really good or really good outcomes. So that should help. So that should convince them.
اوكي شكرا.
ما أعرف أستاذ حسنين إذا عندك وقت نكمل كم سؤال أكون.
Yeah, if you have a few minutes, that's fine. Yeah, we
Okay.
can.
Should Dr. Ali Rada, should we take from all patients if my research was static? أعتقد يقصد consent. For example, if I want to compare between two different sterilization procedure outcome in different hospitals or even in the same hospital that has multiple procedures. مع هذا النص قريته بس أنا
ايوه هذا شفته. يعني هو شو اذا اكو intervention you should take consent. If you're not يعني if you're dealing with data only ما اعرف اذا if you're not dealing with active patient involvement you don't need consent. يعني you don't need written consent. خلينا نقول انت تريد تشوف الداتا مال المستشفى الكاظميه versus مدينه الطب whatever which intervention worked better or something which happened 2 years ago. You don't need the patient because you're not dealing with the patient. But if you are involving patients now, you have to take their consent at least. Yeah, and if it's active intervention, written consent. If it's not, you can think about non-written, maybe verbal consent, something like that.
هي الحقيقة something to be mentioned here. احنا عندنا 3 levels دوما بمعظم الدراسات. الليفل الأول هو agreement from ethical committee. الليفل الثاني agreement from the institution or hospital to use their data and their records. والليفل الثالث of course patients and participants whether oral or written.
Or written. Thank you.
From Dr. Karrar Mushtaq, from an ethical standpoint, is it permissible to independently design and conduct a clinical trial in Iraq involving the allocation of participants into groups receiving different treatment protocols, such as specific medications, for the purpose of comparing health outcomes?
I think independent design conducting a trial, I don't see why not. يعني المفروض okay احنا اي شيء انت you can do any research as long as it's not causing harm, as long as the benefit is better than, or you eventually for good benefit and good outcomes. So yeah.
هي هنا بالintervention يعني بنحكي على drugs اللي registered in Iraq you can do whatever the intervention you. If the drug is not registered هنا you are not allowed to unless you get يعني a certain and يعني higher committee agreement.
وبهذا بكل العالم يعني احنا I can't use a drug which is not licensed in the UK بس licensed بالهند مثلا for patients here unless it's part of the clinical trial run by the company or run by the so انت لازم تستعمل شيء which is approved in your country of course.
دكتور نائل إذا ممكن الفورمز مع الفيدباك والحضور بس تحطها وإحنا إذا أوكي أوكي إذا ماكو يمكن أسئلة أخرى ما نريد نأخر.
شكرا جزيلا
دكتور حسنين. We are very proud to have you with us this session and for the knowledge you shared with the audience. Many thanks for the audience as well.
Yeah,
and we are looking for the inshallah next event in the future.
Inshallah. Thank you very much.
Thank you very much. Salam.